Hello and welcome to Pull Up with Limbs and Things. This is Dr. Chanel James, and you are joining me tonight as we talk about grief and how grief can affect your body. With Pull Up with Limbs and Things, it's always to confirm something you know, to challenge something you don't know, and to give you the opportunity to share that information with someone else. So, we're talking about grief. And that's like losing someone or something. Everyone has experienced some aspect of grief. But I have found that grief comes all the time in waves. You think of the person, you smell something reminiscent of a fond memory, or you even do something that reminds you of the experience. So we can grieve in all different types of ways. We can grieve people, we can grieve animals and pets, we can grieve loss of a job or the job you didn't necessarily want to have. Um, we can even grieve sameness and change. We can grieve independence, like losing your independence, like we're no longer driving, we're no longer walking without assistance. We can also grieve our function, where we are walking and now we have to hop because we don't have a limb anymore, or we have to grieve the inability to speak, grieving also the inability to hear or to hear well, and then even seeing, because the sight is something we can lose as well as we get older. So if you have a question or a comment, you can put it in the chat. But tonight we're talking about grief and how it affects the body. So you're probably wondering, like, why does this have to do, or what does this have to do with physical therapy? So a lot of times, especially in the population that I serve, I deal with grief because some of my patients pass away. And that's a challenge that we all have to face. But also knowing that the stages of grief can occur in your patients and in no particular order. I think there are about 7 of them, whether you're in acceptance or whether you are in shock. All of those things can occur during the course of a physical therapy session when you're working with someone, and then you have to help people get through it. And a lot of times those waves of grief can hit them in the midst of trying to do something that they either no longer can do, or finding that, oh, I can do it now. Because anytime you're at Limbs and Things, your goal is to move from whatever you can't do to being able to do it. So physical therapists, we see people in all stages of grief. They can be going in and out of them in a session, depending on their mood, depending on the memory they might have or their stress level that day. So grief rises up in any physical therapy treatment session. I've had a patient who recently lost their child, and sometimes you just have to take a moment of silence, let the person release, and then give them the opportunity to cry, to get a hug, to share that memory, and then we work, because the work is always more effective. The effort given is always a little bit more following the release of whatever emotion that was incurred from the memory of that grief situation. And then I've had patients who lose their independence, and that is probably one of the harder things, because that grief is always in their face. And as a result, it gets to the point where they are seeing it every time you're there. And so working through those moments of hearing them talk about what they previously were able to do. Like I've had a patient who was an avid runner, run with a dog and all the time, able to go and do anything that they wanted to do. And then they had joint replacements with no residual effects and able to continue to move along with life with no problem. And then suddenly we have a brain diagnosis that makes you dizzy all the time. You're requiring a higher level of care. You're depending on your family to do simple tasks like getting up or even using the bathroom. And those things we tend to grieve throughout the day, because every time you got to go to the bathroom, you think about what you lost. Every time you have to stand up, you think about, man, I need somebody to help me in doing that. So throughout those treatment sessions, I kind of turn into the counselor, where I'm just listening to see where I can encourage. And then we work through to try to change the situation as best we can, because we know giving up is not an option. And so grief can really stifle our progress, but it can also be turned into something that's positive that helps you to push through, especially when you don't want to. And a lot of times, physical therapists are your ones to help you push through. And so, grief, we need to know the grief that is not released turns into a functional block, and it can build into physical manifestations in your health, whether it's your vital signs, whether it's just shutting down completely where you don't want to move. I've had some patients when I was working in psych that just became catatonic with the loss of whatever situation they were grieving. And it is a real hard and uphill battle and journey for that person, but also for that therapist that's walking through that journey with them to try to get from I'm not moving at all to being able to do that. So remember, grief that is not released turns into a functional block. It develops into physical manifestations that can be very difficult to break and be detrimental to your health. So you really want to give room for folks to grieve because it's imperative to them being physically functional in a manner that is good for their well-being. So grieving, losing someone, it always comes in waves. When you think of a person, when you smell something, when you think of an experience you had with them. And remember, people can grieve people, other people, especially those close to you. You can grieve animals or pets. You can grieve jobs, sameness or change, being independent or the lack thereof, when you have to depend on someone else now for driving, as an example, or for your function. Whether you're walking with a device now, as opposed to not walking with a device, you're being independent. You can go up and down the stairs, no problem. Standing and sitting, hearing, seeing, all of those things you're able to do on your own. But then you have something happen where those things don't come as naturally. You have a difficult time doing those tasks, or you need assistance in doing them. That can cause grief to occur. And so physical therapists, we see people at all of the different stages of grief, whether it's shock or acceptance, whether it is their first experience, because sometimes grief has hit people in multiple ways. And so you just want to be aware, first of all, but then making sure that you give room for people to actually grieve so that it doesn't turn into any physical manifestations. Because depending on their mood, depending on that memory, or depending on their stress level, you can possibly have more grief to occur. And then that puts somebody back into that cycle of grief. And they have to work through it. And grief doesn't have a time limit. It doesn't have a start or a cutoff in terms of starting the process of coming out of it. It's not necessarily something someone comes out of. They learn to move through it, I think. However, that is always going to be a memory that comes up. There's a patient right now that memory always comes up. And you just have to be prepared for it. You can't dismiss someone. You definitely have to let them express their feelings, because grief is a very real situation that affects your whole body. And so we want the person to have optimal function. And in order to do that, they got to release that grief feeling that they're having. And it can be where it takes a moment. That we've had sessions where some of it is talking and some of it is moving and talking, and some of it is, okay, we're going to have to call it because maybe you can't get through it at that time. So just knowing how to treat someone, but just being human is the most important thing as a physical therapist and as anyone who works in the healthcare profession. And you're working with people at all and in general, you have to be aware of who you're serving and knowing that, okay, something's a little off today, because people aren't always going to be forthcoming in telling you, yeah, it's a grief day today. But no, the real goal is seeing and being able to interpret, something is a little off. Let me give you some time and space to be able to release that grief so that we can move forward. So grief that's not released turns into a functional block. Please don't let that be you. Remember, pull up with limbs and things is to confirm something you know, to challenge something you don't know, and to give you the opportunity to share that information with someone else. If you or someone you know is looking for a physical therapist, or you want to have our services to come and show you some things that can help you age well, please contact us at LimbsNThings.com. Or you can also send us an email at LimbsNThings@gmail.com. Our phone number is 202-643-2636. Have a wonderful February. And remember, grief that's not released turns into a physical block. Don't let that be you.